already looked to see how to get pregnant, that is, the process for that sperm to find the egg and fertilize it, or not to be pregnant, that is, contraceptive devices. So our window of opportunity to actually become pregnant is rather small. It's only really about a 5-day window, and that circles around ovulation, primarily more before ovulation than after. And that's because the egg is really viable for 12 to 24 hours. I mean, that window can be bigger, but this is where the optimal viability of the egg occurs. And same with the sperm, is about 24 to 48 hours. And so that creates really a maximum of 5-day window. Now, we can get an indication of ovulation from our basal body temperature. That's the temperature before you get out of bed in the morning. And so because of rising progesterone levels following ovulation, it causes your body temperature to go up. However, that's, again, after ovulation, so our window of opportunity is pretty much shot. So if you wanted to use basal body temperature as a way to get pregnant, you can't go, oh, my body temperature goes up, it's time to have sex. That's not going to work because the window's gone. What you can do instead is monitor your basal body temperature over several months and say, oh, okay, well, for the last 3 months, my body temperature went up on day 15, which means I probably am ovulating on day 14. And then you can say, okay, that means then I need to have sex before that in order to get pregnant, just the couple days before that. So you can kind of predict it's probably going to go up, or I'm probably going to ovulate on such and such a date. I wouldn't suggest using basal body temperature as a way to avoid pregnancy, since our monthly periods or monthly cycles are not always exactly the same. That window of opportunity might fluctuate a little bit, and your timing is going to be off, and then you're going to end up pregnant when you don't want to be. Now, the sperm have a challenge. If they do get to the female, they're going to have a challenge to get actually to the egg, and that's what I like to think of as our Olympic feat, and Michael Phelps leading the way on this Olympic feat. At the starting gate, we only have between 50 million and 250 million sperm, which is a lot, but not many of them are actually going to finally make it to the egg. They only have to swim a distance of 5 inches, but sperm are so small, that's like us swimming 40 miles. So that's a big distance, actually. Then they have to swim through the vagina, which is going to have all kinds of obstacles, such as being very acidic. That's going to kill the sperm off. The cervical mucus and fibers can, depending on the cycle, can be really thick and actually completely prevent the sperm from getting through, or limit the number that get through. So you might, even on a good day, have about 1 million sperm make it through the cervix. Then the uterus also has its own obstacles. One, the sperm are going to be swimming uphill, and that makes it hard, and so only a few thousand make it. There's some evidence maybe they lack direction. I mean, there's 2 oviducts, only one of them has an egg in it, so which way do they go? Now they found that there's some evidence that the sperm actually have what are like olfactory receptors that can sniff out an egg and travel towards a chemotactic-like process and find the egg. But of the 250 million that start, actually only 100 of them actually find the egg. And then, of course, only one of those guys gets to penetrate it. Now, along the way, the sperm also have to be capacitated, and that process I'll describe in the next slide. Once they find the egg, they have to penetrate the corona radiata, and that's this layer of granulosa cells that are found surrounding the egg. And then they have to penetrate the zona pellucida, which is a jelly-like coating that surrounds the egg, and that process to do that is called the acrosomal reaction, and I'll show that to you in a couple slides. Then once they've penetrated that zona pellucida, they have to bind to receptors, and that's going to end up triggering a cortical reaction, and that's where the egg is going to dump some substances into the zona pellucida and prevent any more sperm from binding, and we'll look at that in more detail later. And then once the sperm binds to those receptors, then it's going to penetrate or fuse with the plasma membrane and then spill its content into the oocyte and therefore lead to fertilization. So here's what I mean by capacitation. In capacitation, what happens is that the ejaculated sperm have a coating over them, and that coating is negatively charged, and that allows the sperm to travel through the cervix easier because the cervix is also negatively charged, so they repel each other. Makes it a lot easier, smoother to swim through it. They also think that that coating may prevent antibodies from the female's reproductive tract, that is, the female's antibodies from binding with the sperm and therefore preventing them from reaching the egg. And also that coating may end up allowing the sperm to actually bind to the epithelial cells in the oviduct and therefore sit as in waiting for the oviduct to actually, or excuse me, the egg to actually come into the oviduct where they can then fertilize it. So it can sit and wait basically for the egg there. And that way too, the cilia that make up the cell, some of the cells of the oviduct aren't going to sweep those sperm away as they're trying to stay up in the oviduct waiting for the egg. And then finally, once the ovulation has occurred, it causes an increase in the pH, and that increase in pH triggers the sperm to be capacitated, that is, lose that coat around it, and that allows it to unbind to the epithelial cells and then get to the egg and hopefully fertilize it. Once it reaches the egg, though, it's got to penetrate that jelly coating, that zona pellucida, and it does that by releasing its acrosomal enzymes, and those enzymes again digest that jelly coat, that zona pellucida. Now the vitelline membrane is the same thing as the zona pellucida, and so that zona pellucida has receptors on it that now the sperm can actually bind to and hold on to the egg, and therefore it's going to be able to then penetrate the egg or merge with the egg and insert its DNA inside that egg. But now the egg has a challenge too. It's got to prevent polyspermy. That is, it only wants one egg to actually penetrate it and not 100 or even two sperm to penetrate it. So that's going to be the prevention of polyspermy, which is also a cortical reaction to prevent that. And then once a sperm does penetrate and then release its cytoplasm inside that oocyte, the egg has to complete meiosis too to end up being truly fertilized. So here's the cortical reaction that occurs to prevent polyspermy. Basically, again, here's the sperm. It binds to receptors on that zona pellucida, and that triggers these cortical vesicles to release their content into or underneath this zona pellucida membrane, or here it's called the vitelline membrane. And all that, the substances in those cortical vesicles causes water to be absorbed, and so you get a swelling and therefore a raising of the zona pellucida away from the plasma membrane. And at the same time, the receptors, the binding receptors, are also broken up. And so that way, having the bigger distance, the sperm can't attach, and having those receptors dissolved away means there's nothing for the sperm to bind to. So you get one sperm to bind there, and after that, no other ones will bind to it. On top of that, the cortical reaction also causes this jelly stuff to harden and therefore also prevent other sperm from trying to break their way through. That way, now we only have one sperm nucleus being inserted into the egg. Now, fertilization is going to be the union of the nuclei of the female and the male. Up to sperm penetration, though, remember the oocyte is rested in meiosis 2, so that insertion of the nucleus of the male triggers an influx of calcium, and that triggers the oocyte to complete its meiotic division, and now we'll call that a female pronuclei. At the same time, the male, when it inserts its nuclei, that nuclei swells and forms the male pronuclei. So now the male and female pronuclei come together, and that would be the process of fertilization. and now you have a zygote. Now the zygote is just one cell, but it's not going to last that long because immediately when those two nuclei come together, the cell undergoes mitosis, and so then you're going to get the cell dividing into two and in formation of the embryo. So the zygote, in other words, is very short-lived. Now, contraceptive devices, of course, are used to prevent pregnancies, and there's all sorts of different contraception devices. Of course, surgical procedures include the vasectomy. This is to cut and tie off the ductus deferens in the scrotum, and that way sperm can't travel up the ductus deferens and be ejaculated. The tubal ligation is to cut the oviduct and tie it off, and that way the egg can't find its way through the oviduct into the uterus, and the sperm can't get up to the egg to cause fertilization. Then there's contraceptive devices. Of course, condoms prevent sperm from entering the vagina. IUDs, there are different kinds of IUDs. There's the copper IUDs. Copper IUDs release copper into the uterus, and those copper IUDs work by immobilizing the sperm so they can't swim through the uterus and find the egg. There's also progesterone IUDs, and progesterone IUDs make the cervix mucus really thick, and then that prevents the sperm from getting through the cervix or through that cervical mucus. Some progesterone IUDs also can work by preventing ovulation. There's spermicides, which are usually used in conjunction with diaphragm. The diaphragm is just a blockage over the cervix, and along with spermicides then prevent the sperm from moving up into the uterus. There's all kinds of pharmaceuticals. Of course, there's birth control pills. These are progesterone and estrogen pills in combination. They prevent ovulation. So they basically fake the body into thinking it's pregnant. Remember, high progesterone and estrogen levels after ovulation is what maintains the endometrial lining and inhibits GnRH and therefore FSH, so you get no more follicles developing. And so high progesterone levels is going to make your body think that it's actually pregnant, and so there shouldn't be any more follicles developing and therefore no more ovulation. Now, progestin alone pills work similarly. They just don't have the estrogen in them. They work, again, by preventing ovulation, as well as they make that cervical plug really thick again and preventing sperm from entering into the uterus. There are different kinds of progestin-only types of pills or implants. There's Norplant, is a 5-year contraceptive implanted under the skin. Depo-Provera is an injection that can last up to 3 months. Neither one of these progestins affect implantation, although this diagram wants to say it does, so I'm crossing that one out. That is, they work prior, they prevent fertilization, either up here by preventing ovulation or preventing sperm from getting in, but they're not going to block implantation. This is often thought that progestin is going to be an abortion pill, and it's not. Vaginal rings work as a progestin alone pill in that they have high levels of progestin, and these vaginal rings are inserted into the vagina around the cervix, but they don't function like a diaphragm and then blocking sperm or capping the cervix, but they will thicken the cervical mucus like progestin alone pills or by stopping ovulation. The morning after pill is not an abortion pill, so I'm going to cross this one off right from the get-go. The morning after pill is used as a Plan B pill, is another name for it, whereas if you have unwanted sex, then the next day you take this morning after pill. It's high in progesterone content, and what it does is that surge in progesterone prevents ovulation. But if you've already ovulated, it's not going to have effect on that. What it can do is cause the cervical plug to form, that is, make that cervical mucus really thick and block sperm entry. And if you haven't ovulated yet, that high progesterone level would stop FSH and therefore stop follicle development and therefore ovulation. But if you've already ovulated, it's not going to work for that reason. So it's effective pretty much 4 out of those 5 days that you have our window of opportunity. But again, it's not going to affect implantation. There's also some evidence maybe that it prevents the union of sperm and egg, making the uterus inhospitable for the sperm so they can't actually find each other very well. But that's not for sure. It may also, some evidence indicates that it may inhibit cilia action in the oviduct, so that way the egg can't travel down through the oviduct so the sperm can never find it. That might be another possible way the morning after pill works. Now, RU486 is an abortion pill. It can be taken up to 7 weeks of pregnancy and cause an abortion. And this has about a 96 to 98% success rate. So this can be used again for unwanted pregnancies where the morning after pill didn't work, or for a form of birth control pill if you're not against abortions. Now, there are also behavioral devices or behavioral means by which to prevent pregnancies. One is coitus interruptus. This is the idea that the male pulls out before he ejaculates. However, this is a very high failure rate because some of those sperm will leak out during intercourse. And if you get even one of those guys in there, there's a chance of pregnancy. So bad idea. The rhythm method is another one where you basically avoid the days at which you're ovulating, using maybe basal body temperature as a means of knowing when you're ovulating. But that again has a high failure rate because our cycles aren't always uniform every month. Of all the contraceptive devices out there, the one that is absolutely 100% guaranteed to work, of course, is going to be abstinence. Now that brings us to the end then of our look at how to get pregnant. So the last video lecture we're going to look at is basically what happens during pregnancy, particularly the embryonic development and then parturition or birthing process.